Good morning. I'd like to call the Executive Committee meeting to order. Tuesday, October 26th. Mine's? Oh, I got yours on, not mine. Just the important one was on. Sorry about that. Call the meeting to order, October 26th, Executive Committee. Roll call, please.
Mr. Lear? Present. Mr. Hess? Present. Ms. Polk?
Present.
Ms. Weber? Present. Mr. Payton?
Present.
Ms. Parker?
Present.
Mr. Fairfield?
Present.
Mr. Carrico?
Present.
Mr. Featherling?
Present.
Mr. Miller? Mr. Long?
Present.
Mr. Hunter?
Present.
Mr. Wheeler?
Present.
Mr. Searoy? We have a quorum.
Is there a motion to allow Mr. Featherling and Mrs. Parker to attend? Mr. Carrico and Ms. Polk with a second. They're both, it's a medical thing, so just let everybody know. Like recuperation type situation. So it fits. I can just tell you that. Let's just cut to that. All those in favor say aye.
Aye.
Those opposed, same sign. Thank you. Approval of minutes, September 28th, 2021. Motion on that. Mr. Payton, second. Let's go with Mr. Fairfield. All those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. We don't have any presentations. Under legislative, Mr. Lear, did you have some things for us?
Thank you, Mr. Chairman. Saturday, I went down to Springfield for the UCCI educational seminar. Mr. Cookshire and Mr. Snipes were also in attendance. We had presentations from retired Illinois Supreme Court Justice Larry Farthmeyer, and then a presentation from Robert Scott, who is Executive Director of Powered Up Illinois. While we were down there, we learned that that organization is sponsoring a tour of the wind farm out by Kayberry this Friday from 10 to 12 o'clock. Will be the tour, lunch afterwards. I have information on it, and I'll have it forwarded to board members, because all board members are invited if they're interested in this this tour. The presentations by Robert Scott went into some detail in terms of the property tax analysis and the ways in which property tax revenues have grown with clean energy. There were also some future projections. I've got a PowerPoint presentation I can make available to anybody that would like to see the sheets for the PowerPoint presentation. We also had a presentation from Adam Furrer, who is with IEA, it's called. Now, being a former educator, IEA says Illinois Education Association to me, but that's not what this is. This is a group that works with the whole clean energy area, and they have wind farms all over Illinois, including the Kelly Creek wind farm. So there's another PowerPoint presentation from him that's available if anyone would like to see a copy of it. So that was the UCCI things. In addition, of course, we're members of the Illinois State Association of Counties. Their legislative committee is working and meeting to establish a legislative platform. I've had one conversation with the chairman on that. If anyone has any particular legislative items that they'd like added to the Illinois State Association of Counties legislative platforms, why, check with me, and I'll see what I can do to present those to the committee.
Okay. Mr. Hunter.
Thank you. County Board Member Lear, couple things. Any discussion about cashless bail? Also, can you give me more details on this matter that's going to be happening at and Friday at Caberry?
It is a tour of a wind farm. And as I said, it's Friday, the 29th from 10 to 12 for county board members. You will get a chance to look inside a turbine. For obvious reasons, they're not going to let you climb up inside it, but you get to get inside the turbine, and they'll have a presentation about it. Senator Patrick Joyce is one of the confirmed participants.
Thank you.
All right. Was there anything else, Steve?
Nothing at this time.
Okay. I did have one matter, and I didn't know that, well, I had a feeling it would come up now, but I wanted to at least bring this committee's attention to this, because we have an opportunity to support or vote against at least supporting this particular measure. There's been a mad rush to get this Healthcare Right of Conscience Act in front of the legislature. This is they want to change the Right of Conscience Act to protect people's individual choices on their health care, to force vaccinations on people. Mainly it's driven by the unions pushing back on this and not wanting to collectively bargain under that situation. If you look at this, that's not a political statement for me, it's just a fact. Most of the pushback has come from fire, police, and obviously healthcare workers themselves who have pushed back on these mandated vaccinations. Most of those folks, from what I understand, are vaccinated themselves. They just don't think it's government's business to force it on you. Then there's the conscience side of it as well, the people that don't believe in these types of vaccinations. So I will say that this is concerning to me as a citizen, but this committee has the chance to whether to support or not support certain legislation and ask for action out of our legislators on these matters. So I'll just say it right off the bat that you know, the findings and policy from the actual act itself, I think, are very, very important in this, and right from the law of what the Healthcare Right of Conscience Act, when it was passed, with broad support. The General Assembly finds and declares that people and organizations hold different beliefs about whether certain healthcare services are morally acceptable. It is the public policy of the state of Illinois to respect and protect the right of conscience of all persons who refuse to obtain, receive, or accept, or who are engaged in the delivery of, arrangement for, or payment of healthcare services and medical care, whether acting individually, corporately, or in association with other persons. Key there. And to prohibit all forms of discrimination, disqualification, coercion, disability, or imposition of liability upon such persons or entities by reason of their refusing to act contrary to their conscience or conscientious convictions, and providing, paying for, refusing to obtain, receive, accept, deliver, pay for, arrange for the payment of healthcare services and medical care. That seems pretty clear to me, that it was the intent of the legislature to allow you to make your own decision. My body, my choice. And I hope you make the right decision for your own health, but it is your decision. And what I'm saying is, what bothers me is the vilification of people who want to exercise their rights under this auspice, because it has a direct impact on this county's operations, because now the state will mandate our county's employees be vaccinated. Okay, this is not like a real esoteric conversation. This is something that will be coming home within the county government, just not at the hospitals. It's going to come home here. So you have the opportunity to say what's on your mind right now. What bothers me most about this is the position of the governor's office. Through his spokespeople, he's saying things like, this wasn't intended for a global pandemic. Well, nothing was. You know, our rights exist outside of pandemics as well. What bothers me also is the legislature has not done one damn thing this whole time. They've sat there and let mandate from the governor's office be the rule of law. And now they come in to take rights that have been established by previous law away from the citizens that live here. Okay? Whether you believe in it or not, whether you're vaccinated or not, it doesn't matter. Does the government have the right to tell you to stick something in your body? That's the question. I say no. They call the people who are against this fringe elements. That's what the governor's categorization of the people that are against this change. Fringe elements. Let me tell you who the fringe elements are. Cops, firemen, mothers, children, unions, doctors, nurses, old and young, Republicans, independents, Democrats, libertarians, liberals, and conservatives. Boy, those sound like fringe elements to me, don't they? That sounds like all of us. It's across the board. It's not political. It's not ideological. It's within the person's heart and in their mind and what they want to do. So I'm asking if this board will support us going against and asking our legislators to not support this bill, very specifically. And if that's the case, then I would send the letters on behalf of the board. If it's not the case, well then I'll just sit back and have a cup of coffee, I guess. I don't know. It's very troubling that they don't do anything the whole time. The legislature completely abdicates their responsibility during a health emergency and do not take any legislative action, but they come back with this to further limit our rights as citizens and as conscientious people to control our own bodies and our own homes and make our own decisions. So it's your call. And if there's any discussion, if it's Andy, shut up, I'll take that too, and I'll just go back and forget about it. So, Mr. Carrico.
Thanks, Mr. Chairman. I just want to say that I agree with you, and I'm totally against any kind of a government mandate when it comes to anything related to health. I think it should be the individual decision when it comes to what you should be doing to your health. So in that case, that's my point on it. I'm totally against it.
Yes, sir, Mr. Fairfield.
I choose to be a fringe person, and I agree with you.
Thank you.
I want to be one of the elements. Thank you.
Seems like there's more of us than there are of the others, because I just named all the groups that this is targeting. It's not me saying, it's the facts. So, is there any other thoughts? If there's, and believe me, contrary, this is a place to have a contrarian view. I don't mind that. I don't think any of us do. Ms. Weber?
Thank you. Just to review, there is a law called the Right of Conscious Acts that says you can make your own decisions.
Yes.
What is it that we're voting against or for?
There's bills going to the floor of the House and Senate that will say accept vaccinations. Paraphrase, I don't have the language.
Yeah.
I don't know if anybody does. That's been filed, but that's their intent, is to change this law to allow forced vaccinations, especially in collectively bargained situations. That's where this is coming from.
It's not coming from a health issue at all. It's coming from rights.
Mm-hmm.
That's a little banging together.
Mrs. Parker, what? You're on mute. There you go.
Yeah, there we go. I totally agree with this, what you would like to support. I am very concerned for the fact that many people have the immune in their bodies and blood, and they don't need any kind of vaccination. And it seems the government has just overlooked that, period. And I really think that being forced to take vaccination when you're already protected is wrong. And the fact that many people support abortion, and women are saying, my body, my life, I can do whatever I want. I feel that we, as a public, should make that choice if we want or do not want that vaccination, just like any other vaccination. You choose to get the flu shot, some don't get it because of that. It's not up to the government to tell us what to do anymore.
I thank you, Mr. Fairfield. Or Featherling, I'm sorry.
Come on, Andy. Well, I'd like to back you up on that, Andy. I feel 100% with you on this. Whether we submit a letter.
Hey, John, we're losing you. Can you hold on just 1 second? John, we lost your internet connection. So hold on just 1 second. We can't hear you. So sit tight for a second. We'll come right back to you and see if that gets reestablished. We'll come back to you. Can you hear me? Wave your hand if you can hear me.
No, I can hear you. You're back.
Okay, go ahead and see if we can finish that.
I'd like to make a motion that we, back you up on your sentences and come up with a paragraph or two to let them know.
Is there a second on that before we get any further? Mr. Long, Mr. Hunter, do you have comment, sir?
Well, I wanted to hear the comments of our public health director in terms of what his official position is on this particular matter.
Sure. Yeah. If you so choose, Mr. Beavis, you don't have to provide it. He asked, and you may answer or not. Your call.
That's a loaded question.
Well, you're the expert, so that's why, was there 267 people have died in this county since last year?
That is accurate, 269 deaths. That'll be my report when I get up and give my presentation. My personal opinion on what your personal opinions are don't matter at the end of the day. My role as the administrator of the health department is to fulfill our obligations and complete the mission of the health department, which is to promote, protect, and educate the people of Kankakee County. We have done that. We are doing that. We will continue to do that. This discussion, partly of what you're talking about, comes down to a decision on this previous conscientious rule or law in regards to how it's interpreted. I leave that to the lawyers and your personal opinions. That's my answer.
So, and I do have to say, go ahead, Mr. Lear.
I find this a very difficult topic because distinguishing between what is before us and what people are going to generalize on this is something that I would urge people to be very cautious on. The suggestion, for example, that we don't want to force anybody to take any vaccines, I feel uncomfortable with. We have a long precedent of requiring school children to have vaccines to protect them from various diseases, and I would not want us to go back on that. On the other hand, I understand that this is a different situation. We're talking about a lot of adults, and we're talking really a very narrow portion of the whole question of vaccines. Hopefully we can keep the focus on that narrow issue and not fall into a trap of broadening the kind of public policy we have on vaccines.
Steve.
Thank you.
Steve.
I think that's important that there is a distinction here. There's the part about government overreach, and then there's a part about protecting the health of people you love and care about. And I will say this, and I've said it all along, I think my job is to recommend that people get vaccinated, and it's your choice whether you take that advice. I believe in it, but it's not my job to force anybody to do anything. When you look at the rates, and I really want to thank Mr. Beavis for this, I was going to do it later. We asked a question, what's the death rate of people that are vaccinated? And it's 1.2 per 100,000 people at our worst. And it's 0.75% 0.75 per 100,000 people at our best. When I talk about as far as when it was lowest and highest. For unvaccinated people, if you look at the percentage, that's 0.0012% of people in Kankakee County have passed away that have been vaccinated. 0.0012%. The data says you should get vaccinated if you want to live, basically, or stay away from everybody, and even that doesn't work. Or 0.00074% when all things were going as good as they possibly could have. Now, if you're unvaccinated, that percentage at our worst time was 13.23% death rate. There's a nice spread there. There's a good reason to get a vaccination, okay? But it's not my job to force you to do that. And it's not my job or the governor's job to set policy. And now finally, the legislature's acting, but they're acting to be oppressive instead of permissive. And that's my opinion, and that's what I'm asking the board to make a decision on. Mr. Payton.
Thank you, Mr. Chairman. You know, as a former school teacher, that's where my mind went to when we began this conversation. I respect what you're saying. An adult should have the right to make their own decision. But I think as government, as legislators, we should protect the youngsters in school. And that's the only thing that came to my mind.
I would agree, and I, you know, we all know those cases where youngsters have passed nationally. You hear about it. We had someone pass away that was an 8th grade student here locally. They hadn't been at school in 2 years though. Just saying. You know, so it seems like our in-school settings have it pretty much under control. My son was on quarantine at Kankakee for 2 classes, as far as I know, maybe more, for 10 days. And the kids had a mild flu. Most kids get mild flu unless they have some other underlying condition. So I'm not trying to convince you to change your belief. I'm just putting it out there that those are things that I think about too.
I understand.
Anybody else for that decision? We can do a roll call vote then. And by the way, I'll send this to the full board, but I'll also send a letter that the executive committee voted this way. If they happen to call it to a vote, we have something in front of our legislators. Ms. Weber.
Just confirm, we're voting to confirm the right of people.
Yeah, we're voting, basically asking our legislators to vote against this change.
Which is a mandate.
Which is a mandate.
Okay, thank you.
Yeah, of changing this, basically, freedom was a healthcare right of conscience act, to change it to make it a reason to force people to have vaccinations.
So we're voting against a mandate. Okay.
Yeah, that's it.
Well,
Voting against the mandate.
A yes is to vote against it.
Yeah, a yes is
a
to
no.
tell our legislators we don't want to support any change
All right.
to this law.
Okay.
Roll call vote, please.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Polk?
Aye.
Ms. Weber?
Aye.
Mr. Payton?
Aye.
Ms. Parker?
Aye.
Mr. Fairfield?
Aye.
Mr. Carrico?
Aye.
Mr. Featherling?
Aye.
Mr. Long?
Aye.
Mr. Hunter?
You know, I am pro vaccines, but and I understand what this thing deals with. I'm not so. I am like Mr. Payton in terms of protecting our youth, in terms of the issues like polio shots. As we were kids, we lined up without a question, and our parents didn't really have any major concerns about that. So, but I just want to make sure that my vote is not taken out of context in terms of my personal feelings in terms of pro-vaccines. I have had people in my church die from this. I've had relatives die from this, from COVID and so forth. But I'll vote aye, but I want people to understand that I'm pro-vaccine. And there are some misgivings regarding mandations. I vote aye.
All right, and go ahead, I'm sorry.
Mr. Wheeler?
Aye.
Motion carries.
All right, thank you. And if it's okay with the committee, can I include that many of us believe that we should be vaccinated?
Yeah.
But it's a personal choice. Is it okay if I include that as a qualifier?
Right.
Because that's really the intent. That's the intent here.
Yes.
We want to do the right thing, but stop trying to force people to do what you think is the right thing, because someday you won't think it's the right thing they're trying to force you to do.
Yes.
Does that make sense?
Yeah.
It will come something. It will become something down the road that you don't want it to be.
Change the word vaccine.
Yeah, exactly. Go ahead and say that, please, in the microphone.
You know, I think if you interchange the word vaccine with something else, it becomes more clear what the decision should be.
I agree.
Like
All right.
what, inoculation? What do you mean? I mean, yeah, is it just a euphemism or what?
No, it could be something not related to healthcare. The government forcing you to turn around 3 times and turn off the light switch before you leave the house. I'm being ridiculous, but still, put something else in there. You know, kick the tires before you leave for work in the morning. I don't know, but it could be something else that comes down the road. You know, and sooner or later that tends to flip on you when you start oppressing onto other people. So don't forget that.
Because,
yes, sir.
and I preface my, thank you, Mr. Chairman, and you know, because there are over 700,000 people have died because of, you know, this horrendous malady that has confronted this country as well as the world. So, you know, but you know, you got some folks who use this stuff against us, and that's why I made the statements that I did regarding this particular matter.
Right. I think it's important to continue those statements when we send the letter as well. Mr. Carrico.
Thank you, Mr. Chairman. I heard you saying that we should include that the people should be vaccinated. Is that what you're saying?
Many of us believe on the board that people should be vaccinated.
Oh, many others.
It's in their best interest.
Okay.
Health. I don't want to speak for everybody.
Okay. Yeah. I'm not against anybody that got the vaccine or decided to be vaccinated.
Right.
That's not the point here. The point here is the mandate. Not that I agree that everybody should be vaccinated or people should not be vaccinated. I think that comes to the point that should be the person's personal decision when it comes to health. I will agree that everybody should take the proper decision in terms of maintaining their health. If it is through vaccination, if it is through other means, whatever that takes in order to maintain health, that was what I agree. But I cannot say that I will support something like everybody should be vaccinated, but I'm also saying I'm against mandates.
I got you.
Thank you.
Yep. All right, moving on. And thank you for that. It's just been bothering me, and now that I hear it's moving forward, then I thought it was time for us to say where we think, because it will come home, so to speak, at some point. With much consternation to our collectively bargained partners, because that's one of the reasons you just can't do this. It is collectively bargained. If you notice, the state is coming out, they're almost in agreement with ASPE. They had an agreement with the nurses union. They got an agreement with this group. They got an agreement. So they've agreed to the mandate. Well, aren't we kind of a union as the public as well? Don't we deserve the same rights? Don't they deserve those rights that they've collectively bargained? So that's where I'm at. Mr. Hunter?
Me again, finally. You know, Senator Joyce called me yesterday on his way down to Springfield, and he brought up this subject matter as well, too. And, you know, it kind of got him in the corner, but I think he was saying that he may have a conversation with the governor regarding it. So it's serious business. So, and I understand all the comments that people have had, because a lot of us are on all sides of this particular issue. So, and I respect the comments that have been made by you and the people who made comments this morning.
Thanks. All right, moving on then. Information Services, Mr. Duval. Yeah, it'll work.
Okay, I guess that's a lot to follow. I'll keep it short here. Basically, I want to ask you guys, are you having many issues with the iPads? You seem to be all comfortable with it. I believe you all know now, we put at the chairman's request, before every meeting, we put sanitation wipes here. So in case you want to additionally wipe them out, but understand Jason does clean them before we hand them out every time. So they've been sanitized and cleaned, but we'll give you a chance and then we take it away so it's not, so the public doesn't start using them for whatever. In addition to that, as you can see, I'm standing here in front of the mic. We saw people were having over the years problems with the old mics and old mic stands. We've been replacing the mics and the mic stands. So if the public or any of you have to do presentations, we have the easy to use mic stands, which is it's just, you take 2 fingers and you can move it up and down. As you know, if any of you have tried to adjust it before, they were almost locked in your 2 hands and you're trying to speak, you lose concentration. So that's been addressed. We replaced the one up front with a wireless mic some time ago. At some point, I hope to do that here, so you're not having to trip over the the cord back here, it's just the whole process. We can't just do it. You don't care about that, but we are working on things like on that. Some of the projects we dealt with during this previous month, the courts or judicial put in a request for some of the iPads that Andy got for the county from the court system. They're planning on implementing a new system that I believe is part of the state judicial system. They're going to take several of the iPads, place them in several locations through the courthouse, and I believe the annex, and maybe out at the sheriff. Judicial system has, the state judicial system has worked out a program with a website and a vendor that allows the staff member, if you come in contact with someone that you don't know their native language, you can use it for interpretation. And it isn't that, it's not like from what I understand, I want to make sure I don't overstep what I understand it. It's not that you're going to ask that iPad to interpret or speak for you. You actually log into a website, we have accounts there. You'll get a human being who will discuss whatever you need to with the person on that site in their language. They'll utilize the cameras and the mics that are on the iPad. So some of the things, I assume some of the things Andy was thinking about, we don't know what these could be used for. He wanted to grab them and see what the possibility. Looks like this may be a good use that'll help the public and our employees. In addition, we helped a jury system. We've been working on weeks for jury system to update their hardware. Their hardware got antiquated. They weren't upgraded when the rest of the courthouse was. They're their own network, so we replaced their hardware. We worked with their vendor over a few weeks. So they just decided to go refurbish PCs, but newer is just as good as the new if that works for you. So they have new PCs on their network. They have a newer hardware for the call-in system. That's for when you have to call and verify that you're going to be there or not be there for the jury. So we've been working on that for the last few weeks. And lastly, things like we've worked with GIS to give them remote access. I believe you gave funding for them to hire a new support person. We set that up. Planning department, we've set up remote access for VPN. All this we did in between our normal troubleshooting. So, and as you know, we're on budget, so that would be it, unless you have any more questions.
Do you know what lead times are on laptops and those other things that we're getting approval for funding or COVID allocation towards?
It depends on, honestly, if I ask today, it'll be one thing, and if I ask at the end of the week, it'll be another thing. Mm-hmm. They tend to tell you that we have it, and then you find out later that, all right, somebody got it before you, mm-hmm. That'll be next week, and then they do that for 7 weeks. So I always ask, do you have it in stock? If we can do it in stock, we grab those models that are in stock, but you still may not. So you may be told that you're going to get it in 3 weeks and not get it in 7 weeks. I've had, when I did things for highway, I've had things come in 3 months later that they said would come in a couple weeks. So when I'm telling you what they tell you and what you're going to see, it depends on that day.
I just didn't know if you heard about computers, if it was the same kind of chips that were that automotive industry is back ordered.
Yeah, that's been there for a while. It's basically all chips, because it's not necessarily the CPU, it's the chips that are on the motherboard. And say you need a wireless card, it's something in there, well, they can't ship until it's completely done. Mm-hmm. And that we go through majority, but through CDW. Sometimes we go to the Amazon. When we do something that's refurbished, that's in-house in somebody's factory or somebody's warehouse, so we get that right away. It's the new things that we have a problem, and they almost always tell you that it's coming quicker than it's actually going to come.
Right.
So that's why I'm telling people, all right, I can tell you this, but I can't promise you that it's actually going to come in that date. They don't actually tell you accurately.
Okay. Does anyone have anything else for Kevin? Anything for Kevin? Okay, thank you. Moving on. Health Department, Mr. Beavis. Yeah, whatever you need. Yeah.
Good morning.
Good morning.
Okay, I'll go over, I sent the report yesterday to Kelly, and she got that out. The original one I sent, hopefully we got the correct one out. There was just a small change in regards to some clinics that we've got coming up, and I'll tell you about those in just a second. Current caseloads, and I kept the numbers from last month. I decided that it would help to just sort of compare from month to month what we're looking at. You can see the differences. Specifically in the deaths, unfortunately. A month ago, we were at 251. That was a +8 from the month previous, so 2 months ago. However, there has been a bad stretch here where we've had a number of individuals who have passed recently due to the COVID illness, and we're up to 269. So that's an increase of 18 over yesterday. There are some differences between what the coroner reports and what the health department reports, as I've explained in the past. One or the other, and I get them mixed up, is, you know, if you live in Kankakee County and you die, then that's a death that's counted there, versus if you're from Kankakee and you die in another county of COVID, if you've been moved to another hospital. Sometimes that can change the differences between what the health department posts and what the coroner posts. But we just did go over 18,000 cases from the beginning. We are at the 269 deaths. We have approximately 15,000 recoveries, so we're still doing the contact tracing, and those individuals, and as was mentioned before, are individuals who've had COVID maybe twice now, possibly. You know, there are those breakthrough cases that can happen, obviously, and those are individuals that have made it through both times and are recovered. Now, they may still have some of these side effects and symptoms they call the long haulers, in regards to how they breathe and fatigue and things like that, the smell and the taste that take a little while to come back. But they've survived, so that's a good thing. Positive note, some good news to reflect on is the regional positivity rate is starting to come down now. For a couple of months, Kankakee had stayed stagnant at about that 6%, a little bit over 6%. However, we have dropped down to 3.7. The numbers are still continuing to trend down, so that's very good. Will County's numbers continue to trend down. They're at 3%. So our 3.7, you know, makes the total positivity there at 3.1. We are beginning to notice that now with the number of cases that we pull out each day for the contact tracers of who we need to contact. There's less. So we have been able to let a couple of our contractual contact tracers go. We don't need them right now. I hope that that's a trend that can continue, because that's actually a move in a positive direction. They are contractual, so they understand that the job is not forever. Nobody would want it to be. So those are good signs for our county. And then the vaccinations, we're up to 43.57. Again, it's kind of disappointing in terms of our total population, the makeup of the county. However, the boosters have been approved, and I'll talk about 2 clinics that are coming up here real quick, but they are discussing that as early as next week and beginning the first week in November, there will be the pediatric vaccine available for 5 to 11-year-olds. And so we are already working with a number of agencies to tentatively schedule clinics in preparation of. Now, that's going to be Pfizer vaccine, and it is a different dosage than the adults received, that the children 5 to 11 will receive. So that has to be ordered separately. It's not ready to be ordered yet. We obviously have to have the official word from the CDC and then the state health department, and then they have to give us the guidelines and the specifics on how to store the vaccine and everything like that. But it'll probably be about the same as what the adult Pfizer was, but there could be some nuances that we just have to wait for. So we are looking at a tentative date within the first or second week, no later, in November, of doing some clinics then for the pediatrics. As I've said in the past, that is one of our biggest subsets of population, 18 and under, within the county in terms of the total population. So I foresee there being a big interest on a number of parents and then youngsters that would be able to then become vaccinated, hopefully push us over 50% or more. Maybe then, because the children are getting vaccinated, maybe some of the holdouts of parents, and maybe they're waiting for their kids to get vaccinated, which is their right. maybe they'll get vaccinated as a result of helping to calm the fears of youngsters who are just concerned about getting a shot in the first place, let alone that it's a COVID shot. But we're excited about that. We're planning for that, and as soon as we know more information. But the big news right now is that we do have the boosters are approved for Pfizer now. That was already approved, but Moderna and J&J were just approved recently. So tomorrow, the health department is having a Moderna clinic from 10 to 3:30 p.m. So anybody can come in and predominantly get the Moderna. Now, if you come in and you want a Pfizer booster, we can probably work that out. And if you want a J&J, we can work that out. But on Thursday, then that clinic is designed for the J&J. Early results seem to show that the Moderna clinic is filling up pretty quickly. The Johnson & Johnson one, not so much. However, we didn't really have a lot of people, I think, early on that got Johnson & Johnson, and you can get those boosters elsewhere now besides the health department already at pharmacies and locations like that, the hospitals, if they have the supply available. So people may already be going out and getting those somewhere else and not needing to come to the health department. So again, on Thursday, even though it's a Johnson & Johnson clinic, more than likely, if you came in and you wanted a Moderna booster or a Pfizer booster or even your first shot, we can accommodate that and take care of that for you. So that information is there. We put it out on our Facebook and our website so that information is out there for people that are interested in getting vaccinated. With that, I'll answer any questions.
I had one quick one. The data that showed that sometimes if you had Johnson & Johnson and a booster with one of the others was a higher level of protection. Have you seen anything where they're allowing for the mix and match? Or
I've not seen the data, but however, yes, mix and match is allowed.
It is allowed.
Yes, mix and match is allowed. So potentially if an individual came in, their original set of shots was Pfizer, as long as you're 6 months out from those two shots and you decided today I want Johnson & Johnson or Moderna instead, you can do that.
Okay. All right, thank you.
And then we would just, and it'll still go into the system, it gets recorded, and we would treat it the same way.
Mrs. Weber? Ms. Weber, and then we'll come to you, for sure.
Thank you. I just wonder if I have to bring my little sheet that says I have 2 shots already, or is that on your file?
We would be able to look your name and information up if ultimately you forgot your card, lost your card, the dog ate your card, those kinds of things. So, and we could get you a new card.
But it'd be just fine.
Yes.
Yep. Mr. Payton?
Somehow I missed the time frame for Thursday. I'm a J&J guy.
Okay. So you can come in on Thursday if you want.
No, what's the time frame?
10 a.m. to 3:30 p.m. will be the clinic time.
Thank you.
Jasmine, did you have something? I'm sorry.
So, John, there's a lot of misinformation out there. What is the age group that you can receive these boosters? A lot of people have said that you have to be age 60 and older. What are the age groups that you can receive the booster shot?
Yes. Pretty much. Okay, so here's a breakdown, and I had this ready in case this question got asked, so I'm glad you asked that, Jasmine. If you received a Pfizer or Moderna series, so anyone listening or anyone here in the room, if you received a Pfizer or Moderna series and you're interested in getting the booster shot, 65 years and older, you qualify to get one. If you're 18 and older who live in a long-term care facility, you're able to get one. If you're 18 and older who have underlying medical conditions, most of us all have underlying medical conditions of some sort, and those are as simple as diabetes, high blood pressure, overweight, cancer, and other illnesses. So those are, you laugh, but it's true. So underlying medical conditions that make it harder when you become ill with any kind of a virus can make it worse for your body to work through that. If you're 18 and older who work or live in high-risk settings, those could be people who are working in the grocery stores. Those have been open from day one. They never closed down. They've been dealing with the public. Those also could be your people in medical health facilities, hospitals, nursing homes, the health department. Just basically pretty much anybody. The J&J, if you received a J&J vaccine, it's 18 and older, anybody. So in essence, anybody pretty much can qualify. You don't have to say who you are and what you are. If All that we'll be checking, though, for your vaccination status is, are you beyond 6 months, Moderna and Pfizer, and you're allowed to get a booster of any kind. And for Johnson & Johnson, it's 2 months beyond your original shot. So if you received a J&J originally, and it's been more than 2 months, and you want a Pfizer tomorrow, you get a Pfizer tomorrow. But if you want another Johnson & Johnson, then you're well within your rights to ask for that. It's up to the individual as to whether they want to mix and match. I just know, and I've said this a few times to some individuals, people who talk to me sometimes said, well, I got this vaccine and, you know, I didn't like the side effects, so they don't want to risk it again. Because I do know when I got my booster, I did feel that third shot. I honestly can say I never really felt the other one other than my arm was sore, but I did have some symptoms the next day for a few hours, but that's telling me that the vaccine is working. That's what any vaccine typically will have you do, so that's a good thing.
Was there somebody in the back, Mr. Carrico?
Thanks, Mr. Chairman. Mr. Beavis, I have a couple of things here. That comes up to the second page of your report here. You have reported 9% plus of hospitalization and deaths currently reported are unvaccinated individuals. Can you tell me where you got that 9% from?
What page are we looking at here?
On the second page, where do you say Delta variant is present in Kankakee County, the Delta spreads up 2 times more, and so on and so forth, and you say 9% plus hospitalizations of death and death currently reported are unvaccinated individuals. Where did you get those 90% from?
The 90% plus is an approximation. I get that off the state health department's website down at the bottom, where they provide the statistics that now demonstrates that approximately 90% of serious illnesses in the hospitals are unvaccinated and 98% of the deaths are unvaccinated.
Okay, so you get it from the state.
Yes, sir.
Now, is that possible for us to also have a percentage to compare for not just the unvaccinated, but the individuals that actually get hospitalized, they were vaccinated? So you can make a comparison between those two.
If you check the website and see if they have those statistics available for you, I really don't have time to go and make up new statistics.
No, I'm not saying for you to make it. If you're getting it from the state, do they have that available to be compared between the vaccinated and unvaccinated people that end up in a hospital?
At the bottom of their chart on that one page that has this, it just basically says since 2021, this number, that percentage that Andy read, that you can figure out in regards to the total number, but it doesn't base it on a particular total. You almost have to go back and find the data in January and February and March and then try to extrapolate that information. I've not been able to find it readily available.
Okay. The other thing here is on your desk page here, you have put it in here that wear a mask when in public, especially if unvaccinated. I do not disagree that the mask actually protects people. I agree. Primarily if you just cannot keep the distance and whatever on a bunch of people around you. However, what I think that it's a contradiction to what you just said a little bit ago in the very beginning, was that we have breakthrough cases. Okay, so for those that are listening and don't know what that is, because you're using a different term for breakthrough cases, in that case are people that are fully vaccinated or vaccinated that contracted COVID, correct?
Breakthrough cases are people who get COVID who have been vaccinated.
Correct.
Yes.
Okay, so in that case, I'm gonna say maybe a small change in this, say, you know, regardless if you're vaccinated or non-vaccinated in public, especially, you should wear a mask, not just unvaccinated, because what I see in your second page is just targeting the unvaccinated individuals, but now we know that even the vaccinated ones can also contract.
Okay.
You understand what I'm saying?
I do. There was not my intent to discriminate against one subset or another,
because
so
maybe this was in the very beginning, when they were saying, hey, you know, get the vaccine, you don't gotta get COVID, you're not gonna have anything, you cannot wear a mask, and then things changed, and now they're saying, now even if you're vaccinated, you should wear a mask.
That's absolutely true. The CDC still considers Kankakee a high transmissible area in terms of transmissibility with the COVID, and so it's recommended that anybody vaccinated or unvaccinated, at least indoors, is wearing a mask.
So my last question will be this. So if the individual that is fully vaccinated that contracted COVID, can that individual possibly transmit it to anybody else?
Yes.
Okay, thank you so much.
Anyone else? Mr. Hunter?
Thank you, Mr. Chairman. Couple things. John, you indicated that you're in contact with entities preparing for our kids to be vaccinated. And my question is, what have you done with respect to Rosie Williams, who is the clinic director for School District 111? I know that they've had some issues regarding infection of some of their students, and they've had even deaths in School District 111. My question is, what have you done in terms of interfacing with them?
Rosie specifically, I believe, just reached out to us yesterday or even this morning. I was talking with Kayla, the young woman who helps with our public health emergency planning and the COVID planning and the clinics with the clinic director in regards to Rosie and at least 5 other school contacts in regards to we would be interested in hosting some sort of a booster clinic or a pediatric clinic at our schools for the children when we're ready. So we will be reaching out to those individuals and then seeing what we can do. Now, originally we'll start off as we did, I expect, where we'll try to do an event at the health department where there's the mass vaccination, and then when we are able to, we're probably going to hire some contractual staff that we can train to then go out and do these individual events at, we're at this school today, we're at that school tomorrow, we'll be at this school next week, kind of a thing, to help facilitate that. In the meantime, individuals on the weekends, the parents can take their children, obviously, to any other locations if they don't want to go to the health department, if it's inconvenient to go to the health department, but they will be able to do those things. But yes, sir, we are taking the information of those individuals who call us and working out, especially looking at the areas of the county, trying to make sure that we do serve all the populations as best we can, and not just staying, in the metropolis area.
And let me just say this, kudos to you. We interface with the health department at my church, us Methodists, Steve. Anyway, we did a combination of things in terms of having the health department come to our church, in addition to the School District 111 director of the clinics, Rosie Williams. And also we did some crime stuff as well, too. We had Marlo Jones from the State's Attorney's Office, as well as, who else did we have? We had somebody from the Kankakee Police Department, Commander Austin, in terms of if you see something, say something, etc. And a lot of our people who attended were senior citizens, and we tried to allay their anxieties in terms of crime stuff. So if you see something, don't be afraid that the cops will say that Steve Lear called in and said you're selling dope. The assurances were given by the police department as well as state's attorney's office as well too. And any number of people who get inoculated, it's positive. If it's 1, 2, 5, 10, 50, I mean, it's preventing people from dying. And a lot of our seniors attended that particular venue in which you were there on a Saturday. Mm-hmm. Thank you again.
You're welcome.
To that, kind of the fringe of that question is we're running ads to encourage the communities of color who have not stepped up and participated in vaccinations to do so. We're utilizing the influence that certain predominant folks have in the community. Are you seeing any result of that? Are you saying people, I saw those ads that are going out? Have you? I'm just curious on. We always look for a response.
Well, let me say this to you. I can say, because I've looked on Facebook and saw some stuff, Reverend Crawford, Montel Crawford, is a pastor of Morning Star Church, which is the largest African-American church in the county. And I've heard comments positive comments, and talked to James Taylor as well too, and he sought out feedback, and other people thought that was a really good idea. And I think in collaboration with chairman and the health department and other individuals, as well as Jasmine, myself, and other folks as well, that's an ongoing process. And I think it's, you know, they're saying Pastor Crawford, you know, the shepherd of my flock, saying do it, you know, I think that's a positive thing, and it should be a continual kind of process. I'm pleased that we're thinking outside the box, because facts don't lie in terms of those individuals who look like me, and algunas otras personas que hablan español, you know, those numbers are, you know, are very low. And I think if they see people who look like them, look like me, I think they're more encouraged to participate. And I think that's positive.
I agree, and I think, you know, one of the statistics, and this is just getting off the ground with this, you know, this endeavor to work with Jasmine and Mr. Taylor and to try to, you know, get the message out. I don't care how it gets out. If it's from me, that's fine. If it's from somebody else and they trust that, you know, that saying about, you know, I water the plant, nothing ever grew, and finally you add water and it grew. I don't care. It grew. That's how we got there. The plant grew. You know, the percentage for fully vaccinated in Kankakee County has stayed pretty static the last couple of months once we got over 40%. So you can see we went from 42 to 43% for the Caucasian population. However, just from last month, we've already seen a 2% and a 2% jump for both the black and the brown community. So yes, I think it's beginning to increase. And again, once we start to vaccinate the kids 5 to 11 in the schools, that's going to be a combination of all of those populations and ethnicities, and then all around the county. We may get some more parents and adults, the caregivers for those children at that point. I think that'll be our last push. I'm hoping that it gets us over 50, higher if we can, and maybe then the message will start to change. And again, going back to the beginning in that question, whether you have to get the shot or whether you want to get the shot, we're here to give that shot to you. And you will get the best service possible. You will get the safest service possible. No judging. If you come late, you're still going to get a shot. If you were here early, you can get your booster. That's what we do, and we'll continue to do. I promise you that.
Thank you. Yeah, I just figured out, I know how you can increase it by 5%. Use the new census numbers.
I want to do that so badly.
I just thought about that. How'd it go up so much? The data changed. There.
Well, and the CDC uses the eligible populations versus, you know, the governor in Illinois uses just our total population, and they're using that 110. So yes, it is underinflated.
Thank you. Any other questions for John? Thank you.
All right, thank you. Some of his glasses got left up here.
Yeah, they've been there a while.
Okay.
They probably couldn't see him when they left. Sorry. It was right there. All right. Thank you. Moving on. Nothing from schools today. VAC, Karen Smatansky. I don't know if we have that. Do you have anything today? All right. There you go.
I'm going to try to do what you just said.
It drops down.
There it goes.
Does it drop like it's hot, Kevin, or? Sorry, he's talking.
I just have a couple things. One, we do have a graduation for Veterans Treatment Court this Thursday, 2:30, courtroom 300. I think you all received an invitation, but I want to personally invite all of you to come to that. We hope, and it's planned, that our first graduate from 2013 will be our guest speaker that day. This will be our 27th and 28th, or 28th and 29th graduate since 2013. So we're really excited about that. And then too, Veterans Day is coming up. If any of you are off work and would like to come, we are having a Veterans Day service at Small Memorial Park inside the museum. So if it's cold, we don't have to stand outside. I believe it starts at 10 o'clock. So come one, come all. There's lots of services going on that day, and then there's a couple functions even on the weekend. And the Marine Corps League is hosting the Marine Corps Birthday Bash at the Boat Club. So if anybody wants to come to that, the poster's in the elevator. I can't remember the time, but it's in the elevator, even though they spelt veteran wrong. I mean, it is one of those things. So, does anybody have any questions?
Nope.
Yes, Steve?
Yeah, thank you, Mr. Chairman. You planning any visits out to the Veterans Home for Christmas for those guys out there?
So visits, no, because they aren't allowing them.
Well, in terms of...
But we will have donation things going on. Veterans Day weekend at Steam Hollow in Manteno, we will be having a Veterans Day event there where we will be taking donations for the Veterans Home, including their usual sweatpants, sweatshirts, hoodies, personal hygiene products, and snack goods, pop, all that. So yes, that will be on the 13th from 1 to 5 at Steam Hollow.
Can you let us know, because that's why...
Yep, I will send out, yep, once I have firm details, absolutely. We got to get the list from Manteno yet of exactly what they're looking for this year, but we will be doing that.
Thank you.
Yep.
Anything else? Thank you.
Yep.
Is there, I have a report monthly, is there a motion, a second, to put it on file? Mr. Lear, Mr. Long with a second. All those in favor, say aye.
Aye.
Those opposed, same sign. If there's any questions, please, you can ask. She's here, or catch her afterwards. She's way down the hall.
Yeah, so far away.
Hard to find.
Thank you.
Thanks. Under appointments, I have the appointment of Dave Horn to ETSB and the reappointment of Jeff O'Connor to Gar Creek Drainage District. Is there a motion to combine and approve? I'll go with Mr. Hess, second with Mr. Long. If there ever is going to be a replacement for Jim Lamont, this is probably the right guy. Former fire chief, I believe, and he was also representative on this board in the past, I think, at ETSB. So there's somebody who's probably able to hit the ground running. That came recommended from the board. All those in favor, say aye.
Aye. Aye.
Those opposed, same sign. Motion carries. Under openings, there's one opening of the following: Clawson Park Drainage District, Spring Creek Drainage District, one opening on the Zoning Board of Appeals, one opening on the X-Line Creek Drainage District, one opening on the Kankakee Development Corporation, and that's for a Kankakee County board member. This is something a little new. I checked, it doesn't matter where you live as long as you work in the footprint of the KDC, and I call this work. Some people don't. We'll just leave it at that. This is actual work, and so if there's a board member who wants to represent the county board on the KDC board, let me know. Obviously, it's a Kankakee-focused organization, but that doesn't mean it's not open to all board members. So kind of let me know, and we'll talk through it, and if there's 3 or 4, we'll all sit in a room and figure it out together type deal. Just not over 7 will be in the room at the same time. I had to do that math real quick. 2 openings, the Kankakee Township Fire Protection District, 2 openings on McGilvery Special Drainage District, as well as the Canavan Drainage District and Manteno number 9 Drainage District, 3 openings on the County Historic Preservation Commission, and 8 openings on the Regional Planning Commission. So that being said, I skipped Anita. Motion to adjourn. No, I'm just kidding. We will now see if our county administrator would like to say a few words. We do have something important, as we always do, but this one is extra important, so we want to get this on the record. Sorry about that. Oh, this is going to be painful as soon as we get out of this meeting. I'm going to hear about it.
Good morning.
Good morning.
So the news that Andy talked about has to do with the rates for our health insurance. And so remember last month what we talked about was an 18% increase. And this is why I need time to go through the numbers. Once I went through the numbers, embedded in our rates, the rates that we were given in our comparison from Blue Cross Blue Shield were the rates of record, except that last year we received a $150,000 credit, a $100,000 communication credit, a $50,000 credit for moving our vision. Those are embedded in our rates that the employees see and that the employees pay. Not $150,000 worth, but 25% of that, because our employees contractually pay 25% of the rates we're given. So we have to reflect that. So our rates that the employees saw were adjusted lower.
I just want to make sure everybody gets that. The savings we got is passed on to the employees. Okay, I just want to make sure that's clear. It's not like we kept it. We have to give it to them as we should. Go ahead.
So once I looked at the numbers that Blue Cross used in the renewal, they didn't include that 150. They excluded it. So once I put that in, it really resulted in a 21.7% increase, not an 18% increase. So what ended up happening is that the chairman went back to Mr. Lynch, who went back to Blue Cross, who gave us, as of last night, we received word that they gave us a $100,000 credit. So once you, of which 25% of that gets embedded in the new rates for our employees. So once I did that this morning, then the rates turn out to be 19.59% increase, not 18. So for the plan, just so you understand what the implication is, the plan that 90% of our employees are on, for single coverage, that's an extra $1.44 a month. For family coverage, it's an extra $4.36 a month. So not huge, but we did get that extra $100,000 by pushing back and first identifying the issue and then pushing back, and kind of a little strong arming, I think, went on. So that's where we at today. I'll be communicating, and Andy asked me to put together something for the employees that he had communicated with. So I'll get that ready as soon as this meeting's over, and then we'll get that out so everybody knows. And then we can turn around and start working on. And when people say, well, I don't understand why it takes you so long to do renewals, this is why. Because you have to go through these numbers, and once you go through these numbers, now that we've got the number as of last night, now I can start everything all over again for setting up our open enrollment and all the calculations and getting the software changes made that need to happen for our open enrollment software. So, questions on that?
Mr. Hunter?
Thank you for the transparency.
Yeah.
Sure.
Yep, and the one thing is, I said, whatever system you have to have, Anita, me, our broker, our consultants, Blue Cross, whatever tickle file has to be created, there's no excuse for forgetting about this next year. It's got to be front and center in all of our materials, because when you get the renewal numbers the day before, you have to come before this body and talk about it. It makes it impossible to do what Anita's talking about.
Right.
It's dangerous, and in this case, the bite was small, and we were able to take some of it back, you know, so to speak. So. Anything else? Sorry.
So, and then the only other thing I wanted to talk about is just where we're at with recruiting. That's kind of been a topic the last several months. We are doing better. We have 10 current openings. We had 14 last month, and we had 16 in August. So slowly by slowly, we're ticking away at it. Over openings that are over 30 days old, this month we have 6. Last month we had 10, and in August we had 12. So that's helping too, that more and more of them are current openings, and that helps us a lot. Our big one is probation officers. That is counted as one opening, but Tom said when I talked to him yesterday, really there's 3 to 4 they'd like to have. So that seems to be a stressor. We did start putting it on Facebook, all the new openings, and then we may target it after a while. There is a concern with the county engineer, highway engineer. We had, out of our initial posting, and if you remember right, we sent that to two professional organizations within that area, the IACE, and Illinois Association of County Engineers, and Illinois Society of Professional Engineers. We got one response. Mark targeted some phone calls to contacts he knew, and a week ago we went ahead and put it out on LinkedIn. We got one additional, so now we're up to 2 responses. But the concern with that one is we really want a nice long lead time to be able to have that person work with Mark. It's concerning that at this point we have 2 responses. So that's my biggest concern right now. I think that's really it. Circuit clerk has 2, and highway, there's still a highway engineer technician. So engineering technician. Oh, they did tell me yesterday there is an offer pending. So hopefully we'll get that one filled too. But of multiple openings, those are the only one. A Bright Point Planning, which had 30 to 60 days ago, 3 to 4 openings, has 1. So good, we're making progress.
Was that the one that went out today?
New posting today. They had thought the posting was up for a transportation manager. That wasn't actually posted. It was a posting for a transportation technician, and so they corrected the posting, and it reposted today as a manager position. That's the one they're looking for now, the one opening that they have.
Got it. Mr. Hunter.
Thank you, Mr. Chairman. Anita, those positions which you filled, what's the breakout in terms of race, sex?
I don't look at that as we hire. I look at that as we do reporting.
No, I'm saying, what did you do? I mean, what are the results?
I'm telling you that I don't know. Of the 6 that we've hired, as we hire employees, I don't look at what their race is. When I do a reporting, because in order to look at that, you have to look at who resigned and the race of that person. I do a report every few months. I may run and look at what our total percentage is. I looked at it a month ago. I did not do it before this meeting, quite frankly. A little bit of chaos the last couple days, so I didn't have time to run that yesterday. But I did notice 30 days ago that our over the last year, both our Hispanic and our Black hiring is up a little bit, about 1% or so. So if you remember, a year ago, the percentage of Black employees was, I believe, 11%, 10%, and I think it's now 11. Hispanic, there's a little bigger range. They were about 5% low, and now they're about 4% below where they should be as compared, our employees as compared to the population in Kankakee as a whole.
15% of our population in the county are African American, and you're saying that is 11, so you're correct in terms of being minus 4%.
Correct.
Do you know what your bilingual, let me just ask you this. Maybe I'll find out from somebody else, but do we offer any bilingual pay at all in any contracts?
That's typically done by the hiring manager. What they do, I will say this, I had a new, not a new posting, there was a posting that's been out for a customer service rep in the public health department. I had a couple conversations yesterday with Nicole from the health department about why that one was taking so long, and she said, well, it doesn't, what we're really looking for is bilingual, and then that wasn't in the posting, so we corrected the posting and actually made it specific to bilingual. And then I had several conversations, email conversations with Ms. Ojeda, and it is, and I talked to her about that.
Good.
And
Natalie Ojeda is the chairperson for the Hispanic Partnership, and she also works for Dwayne Dean. and she is also the vice chairman of the Moments Park District, really involved in the Hispanic community.
So what I spoke with Ms. Ojeda about, Ms. Ojeda is posting that one and the probation officer too on the Facebook page for the Kankakee County Hispanic Partnership, so that we can hopefully target that community a little bit more and drive the numbers up there for people that see it and respond.
Yeah. I think it is important to remember that we do encourage these types of best practices, but substantially limited HR authority within the structure of county governments, because we're not the HR department for the health department or for 911 or for all of the elected offices.
Correct.
They can lean on us. We offer help, but typically they run their own programs. And that's, we just like post out of courtesy jobs and try to find help as we possibly can.
Well, I don't know.
We're not their HR department. I just want to make sure you know that. But we still reach out and try to help as best we can.
I'm not sure that the word courtesy is the appropriate word. I mean, it's a best practice, and I think we're obligated to do what we should do in terms of recruiting and hiring people that are reflective in the demographics of the county.
I just think that extends to those people who have that authority within those offices, because that's not a mandate that we are under. It's the right thing to do. So we try to help in that endeavor as we possibly can. If you, I'm sorry, did you have anything else? Okay.
Not unless there's anything else for me. No. Okay.
All right, thank you. Thank you. We do have that mandate for those who directly work for administration. I want to make sure that's understood.
Yeah,
we do have that because we're directly accountable. We have to do the EEOP reports and all of the other things out of county government. So we have that mandate.
And there's Title VII of the Civil Rights Act too.
Yep. We're not messing around there.
No.
Next up was new business. I'll try to make this as concise as possible because we've had a whirlwind since, I want to say, Finance Committee meeting, maybe when this last came up. So with the ARPA funds and the rules that the federal government has put upon us, anything over $50,000 that is either given to an entity by the government or given from the government entity to another entity, they have to be GATA certified in order to receive over $50,000, okay? They have to be compliant, certified. They can't be on the list of people who are not to be given money to, so to speak. And unfortunately, so this forces us into a different methodology for the Pembroke situation, because that was well over $150,000. So that's why we have to have an IGA. That's one of the reasons we have to have an IGA between Pembroke Township and the county for this project, okay? Because we now have to take the project if we want it done. They cannot bid it out. They can't do anything. It's our project to do for them. And Mr. Payton is working with a lawyer to, once that situation, then Mr. Rowe's office will have the ability to work out the IGA between the township and you know, the county. What I'm asking for here, you know, is because we have to do the bids, we have to do everything. We also don't want to assume any liability for this. That's a major problem for me, that 5 years down the road, all the players change, something breaks down out there and people say, well, you fixed it, that's on you. That can't happen, and it won't happen with this IGA. So we want to help. We want to help be the conduit for positive change and fixing the sewage backing up into people's houses. We've all said that, but we can't do it if we're going to assume all the liability for the project. So we're at a good place. This is a good thing, but just letting you know, over the course of the next few weeks, we want to be, for the full board, ready for me to sign this IGA. So I would need it to pass here and then go to the full board. We just have to draft it now with the help of the two opposing sides of it. Mr. Rowe can't do it for the township. They couldn't do it for us. It has to be lawyers talking together. Is that probably the best way to put it, legal team in the back? Okay, they can't go unrepresented, and we can't either. So that is the reason we need the IGA. We can't have any liability. And so we can get into some more after that, but I just want to make sure there's no questions, and we'll need a motion to allow for this IGA to be crafted. And then the full board will allow me to sign it once that happens.
Mr. Chairman.
Yes, sir.
I just want to mention that our board is meeting this evening with the attorney to be approved for the IGA report.
Okay, thank you.
Come on, Sam, make a motion.
So is there a motion to allow that to start with, the IGA process? Both Ms. Polk and Mrs. Weber for a second. Is there any other questions, Mr. Hunter?
Would anybody be adverse to having a unanimous second on that? Can we, anybody have any problems with that? Anybody at all?
No, I don't.
So would the record reflect it was a unanimous second of all the people on the committee? Is that okay? No adverse comments? Okay, thank you.
Hearing that, all those in favor say aye.
Aye.
Those opposed, same sign. Now, I know you're approving something without seeing it, but that we need to do this in order to get something to see. The concept is we need an IGA. You'll get to see what that is, and you can vote against it at full board if you don't like the terms of that IGA. We just need the committee to vote to get it to the full board. Mr. Hess.
Thank you, Chairman. That means then that the county will pay all the contractors directly?
Yes.
Pembroke Township won't
they
have
won't
any?
pay anything directly unless there's something that needs to be paid directly that may be ancillary to the project. So, but I don't see how that would happen. It's still using ARPA money.
Correct.
For this. That's still the situation. That hasn't changed. So the next item, we'll talk about how much of the ARPA money in a second, because that Friday was, for everybody, was a heck of a day. So we'll go through that in a minute. So that we voted, correct? Okay, so we'll get that together. We'll bring it to the full board once the attorneys are able to start talking. The second part now, the project has to be broken into two parts. And that's why this next item, up until 4:15 on Friday, this was still the case that we needed to have a bid letting here, because the three quotes that we got, this is over 30 grand. So the three quotes we got are just quotes. They're not bids as released by the county. So I was going to have a bid letting today, had ads going in the newspapers, because we had to rebid this whole thing to be in line with the procurement code, okay? So at about 4:15, we realized, after talking with, and I'll mention, there's three engineers involved that we were talking on this. I'll call it past, present, and future, maybe, to steal a local phrase. But the need, there's a gentleman by the name of Jim Earlywine who was working with the township, had come up with drawings years ago, currently trying to help them out pro bono. He works for MG2A, but he did some pro bono work trying to help them at least figure out what needs to happen in terms of so we don't see this movie again in 4 years. If something happens, it can be bypassed. That was the ideas that were had, and there was drawings and things like that that existed. I had contacted Neil Piggish because we needed an engineer to represent us, and I knew Neil had done work with Mr. Earlywine back in their old days at Tyson out there years ago, and I had talked to Neil and others when this first started. So we have this team that's working together on the engineering side, but the reason it has to be broken up into two parts is because there's a high likelihood this has to be permitted as well, because it's a modification and it has to go to the EPA. And I see Larry back there shaking his head. So you just can't do modifications on wastewater systems. Now, there is question whether a bypass valve, if things break down, is a modification or not. So we didn't want semantics to delay the project for 2 more months unnecessarily. We also figured out that there's a good indication that the main line is not under pressure, which means that we could go in there for an under $30,000 price, which you'll see in your packet, kind of get the tank pumped out, get things so it's not back up into people's basements. So that's phase one, and it doesn't have to be bid, okay, because it's under 30,000 and we've got a price here. Then phase two would be the modifications with the EPA permit and everything that the engineers would be working on down the road. Okay, it's strange in my old life doing these things that just collided with my current life, and working with the engineers, We think we've got something that makes a lot of sense in the short term and the long term. So if we just went out and bought pumps and motors, it still wouldn't be working at the very beginning. This would actually help us, and the engineers are all kind of aligned on this, that we can get the situation mitigated for the immediacy, but then also start working on what the long-term fix is in this situation, which has a TBD dollar amount right now. So we already have authorization to spend up to $150,000. So we don't need to get that reauthorization. It's just I wanted to say in open meetings, you know, this is kind of like, I want to make sure that the next line on here, that the committee knew what the plan was and have anybody a chance to question, because it has to start moving. Okay, we're going to start working on this. We've already got authorization. As soon as the full board approves this, as soon as the IGA is done, we're going to at least jump right in, pun intended. We're not jumping in anything, but
you first.
Yeah. There's no wetsuit that's thick enough to fix that. No, but so what I'm getting at is we're going to jump right in as soon as the full board approves it with the mitigation side of it, while we work on the engineering and the applications to the EPA and everything else. So government works slow, but in this case, I'm glad it did, because we could have potentially wasted money at the very beginning. That wouldn't have solved the problem. So, do you have anything to add, Mr. Payton? Because we talked throughout the day.
I just wanted to publicly thank you for getting involved and acting as a conductor for this whole process, because with my knowledge of the wastewater system, we would still be fumbling around. So I thank you and I appreciate it. And my community, thank you.
Well, I appreciate that too, and it's the board, and it's really the other engineers that all stepped up. You know, obviously engineering firms like contracts, but they also like to help people as well. So we're talking about MG2A, Piggish Engineering, and then personally Jim Earlywine have all stepped up in this situation as well. So at some point we're gonna have to pay somebody. We're gonna figure that out, you know, for doing this work, you know, but that's all part of this process. You know, there's only so much pro bono that goes. So there's got to be some bono somewhere. So anyway, I want to make sure you knew that. Next item. I'll try to make this one quick too. We had a situation come up in finance. We mentioned it, that we have a blanket policy that says, okay, we'll give money to non-for-profits, but they're in the same capped fund as the municipalities, and if they're in a municipality, the way that it reads now, they're only, the municipality has to step up for the other 50%. So it's if you remember that policy, it was to encourage participations from those other governmental entities that got money without forcing them to do it. If they so chose, they could get into it, whether it's a for-profit or a not-for-profit business, and then those governmental entities that serve both, like those fire protection districts that may have part of a town and part of a rural area. So we're looking at this and trying to figure out exactly, okay, the intent was to not just carry all the water ourselves, but some of these not-for-profits serve the entire area. And so the committee thought we should revisit that finance and say, what do we want to do? Do we want to do the whole 10,000 for non-for-profits, even if they're in Bradley and they serve everybody, or they're in Kankakee and serve everybody? You know, there are non-for-profits that only serve municipalities. So we should kind of constrain those to the municipality and do the 50% there. My opinion, you decide. So it's really up for discussion on how we want to amend this. I would recommend we go those two directions as opposed to, you know, anything else, but please, the floor is the place to discuss. Mr. Hunter.
I think the key word we were going to insert was macro, and I think we brought that up at the finance committee, because as the chairman has indicated, some of these entities serve more than just their immediate vicinity or area. So it's macro in terms of myopic.
Mrs. Weber?
Thank you. I just wondered, does this then allow those persons or the companies, if they get the 10,000 from us, to also partner with the municipality for some more?
The municipality can give them more if they want to.
Gotcha.
Yeah, it's not limiting anybody. We can only do us, so to speak. And I hope they do. In most cases, like, you know, I'll just mention Harbor House and places like that are completely community-wide, but they're in the city. Why should they be penalized of all of that as well? So It's basically from this point going forward, we want to make sure that that's what we're doing. And I would say if somebody that only got half the first time or didn't get the full amount, they can shoot another application in for the rest, and we'll consider making them whole, so to speak. I don't want to go back and start figuring out who's who, but I think if they feel that they were shortchanged, so to speak, that they could send us another application for the remainder. Yes.
Additionally, though, some company that's totally within a city only, doesn't serve anybody else, would still be stipulated by the 50%?
Well, let's speak non-for-profit.
Okay, thank you.
Okay, because company is a little bit different.
Yes,
company is, well, actually completely different.
Yeah.
Because tax revenues derived for the city and the county in that area. So yeah, it would be just not-for-profits.
Okay, thank you.
Because there are some that are just dedicated, like just for the city of Kankakee.
Yes.
They only work there or Bradley or somewhere else. Then I think it applies, and that, I don't know if people here agree as well.
But it would be step one by one decide. We'd have to look at each one.
Each one, just like we're doing now. Every single one has to be, it just has to be added to our criteria, our vetting criteria. We couldn't have known everything when we started this, and this is one that kind of came in. I've got another one here to ask you about in a minute, but besides that, Mr. Lear.
Thank you, Mr. Chairman. What I see before us, I'm favorably inclined toward. What I'm not sure is, do we have established criteria that is going to limit the nonprofits to the $10,000 amount? Because this doesn't seem to talk about what would be the limit on a nonprofit.
There is no delineation between the two, so they are limited if they're in the municipality. So there is no delineation between a for-profit and non-for-profit under the auspice of the ordinance. We need to build that delineation in.
Okay.
And so my recommendation would be, one is if it serves the, more than just the town they're in, it could be two. It could be the Kankakee, association or Kankakee Bradley Association for whatever, and they just focus on that. But as long as it's more than one.
Yeah.
I don't want to go around all the mayors trying to talk to them about splitting this up, because as I say, nobody's got time for that. But what I would like to see is participation if they so choose. The other thing would be, we have to have a way to determine what that is. So if it's bylaws, served by zip code data, or some other method of determination of the service area, that's part of what we would require from a not-for-profit. Does that make sense? We trust but verify, I guess, is probably the best way to put it. So I think they serve a larger area than what they have right now. They're not-for-profit, obviously. They're eligible for the full 10,000 with no municipal share, and that we just need a verification process as mentioned. That would be kind of the motion. So, Mr. Kirkster, did you have a question?
Yes, not a member, but I'm trying to understand this, and maybe somebody else has the same question. But what we're saying is a non-for-profit puts in an application for funding, and if they show that they are basically county-wide, okay, not necessarily just within a particular or their particular municipality, that they will be able to receive the full amount of the funds. And then if they are just for their particular municipality or area that they're in, that whatever municipality or jurisdiction that they're in would be a 50%.
If they so choose. Yeah.
If they so choose, yeah.
And I don't know the best way to say this, because we're going to have to meet with the people who know how to say this. They're sitting behind you afterwards to try to get out the intent of this committee onto paper.
I can feel the hair on the back of my neck standing up. I know they're there.
So there is a best way to say this, but the intent is to do what we're saying.
But basically, the county is going to assist, is here to help assist county-wide.
Right.
Basically is what it is. But the municipalities, as you said before, they need to have skin in the game too, as far as helping out.
We're here for those non-for-profits as well, but we would just like to see others participate.
Right.
If they are just for the home team,
correct,
so to speak.
Okay.
We good with that? Is there a motion then to accept that and send it on? Mr. Hunter, second. Mrs. Weber? John, keep it down there. You're making too much noise. I'm just kidding with you, bud. I just happened to look over. All those in favor say aye. Aye. Those opposed, same sign. Motion carries. Thank you for that. We'll work on that, and there'll be something that is more succinct for the full board to consider. The old business that I wanted to bring up, and then we could take others, is I'm getting requests. Yes, Mr. Hess.
We're actually spending money. Shouldn't that be a roll call vote?
Oh, it's a policy change.
Well,
We're not spending money on anything specific. I'll do roll call, that's fine, but I don't know if it's necessary.
know-
Yeah,
You're not spending money, you're changing the policy.
yeah.
he said no.
Okay,
I
all
was
right, but
just
that's
wanting to
okay.
make
I could have
sure we
been,
got it
and usually I
right.
am wrong. No, I'm just kidding. But sometimes I am, and would have taken that advice. But anyone can say roll call at any time. Yeah. So I'm in a kind of a quandary, and I think I figured out something, but I wanted to get the executive committee's kind of thoughts on this. I'm getting applications from churches for COVID funding, and some of them are based on lost revenue. I've talked to John about this, and Mr. Coughlin from the State's Attorney's Office. And I think we have a clear path, but I wanted to get the opinion here because there are Supreme Court cases, and I found this on the HHS website, federal, that say you can't use federal money for religion, proselytizing, trying to convert people, all of that kind of stuff, basically for church services. But you can use it for programs. And so Steve is here. I'm glad you came down, Steve. The issue that we find is the churches are claiming lost revenue. And that becomes very problematic for us because that kind of pushes up against that notion of that. Now, if it's for a food bank program, well, then that's something we could do. That's part of the stuff we've kind of set to the side, and we're putting out that RFQ for people to help us with. But if they're using it to justify, we need 10 grand because we lost over 10 grand in passing the hat, that's general, that's for church services, and in my mind, and it's not for, we'd have to talk it through, but some infrastructure improvements. Well, if they're for the freezers for a food bank program, well, yes, but if it's a new refrigerator so we can have whatever for the service, I don't know. You see where I'm at? I'm in this, it's a weird spot because there's a lot of churches out there, and there's a lot of people who got their ordained over the internet, and they could say their church is the bar on Sunday, and so it's the Church of the Chicago Bears. And I'm serious. I hate to say that, but we could get stuff coming from everywhere. And
It used to come off the back of a matchbook.
Yeah. So I guess, and Steve, I don't know if you have thoughts on this as well. It's just, it makes it tough for us because we all are connected to or actively engaged in our own congregations, and we potentially could be delivering bad news to people who had a bad year, as far as revenue for their churches. But the Supreme Court says you can't do it. Now the question is I just want to focus on what we can do, and that would be for continuation of their programs, not the preaching. And does that make sense? Okay. And Steve, do you have any thoughts there?
Yeah, maybe the Bears need to go to church first before they
Yeah, they need a lot of faith these days. As fans, we do.
Yeah, summarize, we're still researching, trying to find, that answer. When the ARPA rules came out, it didn't say anything of restriction. So we're kind of blending, thoughts and ideologies, trying to figure out and make sure we take the right path. The other reason I came up, if I don't mind, with the committee, with the change with the non-for-profits, we had a number of them that went through last finance, whether they were going to be 5,000 or 10,000. By the time it gets to the board, will they be at 10,000 since they're all going through at the same time? Just trying to clarify that.
Well, yeah, we said at finance, if this committee took the action that we just did, then they would be restored to their full request. Well, not the request amount, their allowable amount. The capped amount, exactly. Yeah. Yeah, we had talked about that in finance. So if we said, wait a minute, it's not 10 grand, it's 5 grand, I think Merchant Street might have been one. They will be 10 when it goes to the full board based on this action. So the full board will approve this first, then the funding request. Does that make sense? Because we didn't want to have another finance committee meeting to fix all that. I hope that makes sense. I'm trying to save time and money. Mr. Lear.
Thank you, Mr. Chairman. In regard to your original concept, I'd heard some discussion on this and the distinction between worship and evangelizing and programs made some sense to me, but your reference to how a congregation identifies lost revenue suggests to me some real difficulties I think I'm going to have some problems with, because I don't see frequently congregations raising money for programs separately in their fundraising. I think it, in all likelihood, most frequently done just a general appeal, and then some money is spent for the worship and for evangelizing. Some of it's spent on programs. Sure. So I'm having some difficulty right now.
Well, the attorneys also, the state's attorney expressed the same difficulty. It's not as much of providing the funds, it's the monitoring. How do you go monitor that after the fact? There's no way for us to go monitor that, really. As I looked at the HHS website, typically people start a separate 501c3, 5, 6, whatever, off to the side for those types of endeavors. This is just the start of a conversation, but I think you have the same concern as I did, is what it's really, we could do it, but how do you go monitor it after that? You know, so it doesn't go to the purposes that it, by law, it cannot. Well, and we're on the hook for making sure that it doesn't.
Well,
so.
I think about it, a church might consider their Sunday school program a program, and we might see it as a kind of evangelizing. So yeah, making the distinction between the two becomes difficult.
Mm-hmm. Yeah, and I'm not saying looking for action today. We may have to come up with something down the road that, you know, programs that are just not available to their congregation, that are for the community benefit, or, you know, what we're gonna have to think about what a policy is. But I'd rather at least throw the idea out here and have people come back in, because we got time, but they're starting to pile up. I'm getting a few of them on my desk, and so I have to be able to respond to them at some point, so just not leave them hanging. You know, so maybe be thinking about it. If you have thoughts at the full board, maybe we can revisit this. But for executive next month, I think we should have a good idea what our plan should be. Sound good? All right, because we're all part of that community. We're all going to get questioned by people. Why aren't you giving the churches any money? Well, it's kind of a sticky wicket there, you know, legally. Thanks, Steve. Any other questions? All right. Any other old business, new business? Mrs. Weber.
Thank you. There's a proposal in our packet that isn't needed though today.
Well, that was just so everybody could see what that we've already voted on that in the finance committee meeting. So it's just, I wanted the committee to see that there is a real proposal. It's under $30,000.
Yes, I see that.
And the drawing in there is what they're basically going to, you know, do longer term.
Okay. So
yeah. So I just wanted you to see this is not just, you know, this is what we put together on Friday.
Thank you. That
we have a proposal. We already voted on it in finance with a not to exceed number. Mm-hmm. Yeah. So we're okay. Mr. Hunter.
Land bank update, if anything.
Yeah, land bank, the first organizational meeting, I want to say, is Thursday? I'm sorry, Thursday or Friday. But it's the 3 members we appointed, 3 members the city appointed, a few resources outside. It's basically a training for all parties concerned to get our arms around the land bank, you know, and then hopefully start working on our strategic plan for the next year and then the following years after that. So it's just getting going, and I could not be happier. I do see a very positive and strong ARPA connection to this land bank, and my conversations with the city of Kankakee as they see it as well. There's some things that could be very unique and dynamic we do in combination that really improves the tax base and access to housing. I just don't see how we can get it together for any type of eviction crisis or anything like that, because I'm really pushing, but you can't push too hard because it doesn't exist yet. You know, if you're talking about housing and boarded up houses and things like that, lack of opportunity, lack of housing in the area, you know what I mean? There's not a lot of inventory of places that are ready to go. If so, they're gone, so to speak. They're bought and people have taken their profit. So yeah, I wished I had a better answer right now. We'll get that board moving. And then, you know, we got a year between now and the next tax sale. That's all I can say. And there's a lot of properties that go to tax sale that could be repurposed, whether commercial or residential, through a land bank to get them back on the tax rolls right away. And you know what that does, right? We've talked about that. They wipe the liens away. They wipe away the back taxes. Us as the trustee, we can do that. The county, the cities can't do that. We can't. That's our value to the land bank, which is why those properties like the one across the street just sits there. You know, it's the liens and back I mean, it's just, no one will buy it because you're buying debt at the same time. So, all righty. Sorry about that. I know it's been a long meeting. Thanks for your 1 hour, 45 minutes and 13 seconds. Mr. Hess?
I'd like to make a motion to be adjourned.
Mr. Hess makes a motion we all appreciate. Mr. Carrico, second. All those in favor say aye. Aye. Those opposed, same sign. Thank you.